for adults, but we need a perspective for these fractures in children, and for that I have invited Dr. Agarwal, who's a pediatric orthopedic surgeon, to take his views on fracture of the clavicle in children.
Yeah, thanks, Harshad. Orthopedic surgeons will be orthopedic surgeons, right? So we will not leave the pediatric clavicle. And I'm here to give you a timeline of the management protocol as the literature gives it to us. I'm not like an advocate of operative interventions in the pediatric clavicle. So most of our patients actually belong to the 1 to 9 years age group and consistently are handled well by our figure of 8 and the sling. However, the Cochrane review has trashed the figure of 8 and now the sling is enough for most of the kids. So when we give a talk on pediatric clavicle fractures, it's actually the adolescent pediatric patients, right? So you exit out of this hall and you upload on WhatsApp, a friend has sent you an X-ray of a 15-year-old, 16-year-old IPL level bowler with a clavicular fracture of his bowling arm. Okay, mark the sports, the bowling arm. So what advice do you give him? So before you even give the advice, he has uploaded his follow-up X-ray. So he's already operated the patient. Similarly, now you get another X-ray saying, this is a 12-year-old girl. She's not playing any sports, but she's got this bad clavicle fracture. And you say conserve, but before that only it's operated. So have we forgotten to conserve? Not really. We are getting good enough results with conserving the pediatric patients. So which are the specific patients which we may not conserve and which we conserve? So abroad, they are actually bringing out articles completely trashing any management of clavicle fractures, and they are not even asking patients to follow up. They are just giving handouts like this saying that your child has a collarbone fracture, don't come back unless you have big symptoms. But the literature shows otherwise. So the first paper on operative management of pediatric clavicle fractures actually came in 2002. Mark the years, okay? 2002. There's nothing before that. And they reviewed up to 1,000 patients operated over a 20-year period. And they had only operated on 1% of their patients. They had got significant indications like open fractures with major soft tissue impingement. However, you see the red arrow? It shows that they left one indication in doubt, dubious, severe shortening of the shoulder girdle. This indication was taken on. Okay? Then there was a complete silence for 7 years. Not a single paper on pediatric clavicle fractures. But there was a lot of information on the adult clavicle fractures. And then we started taking it up in the pediatric review. So the AAOS started giving a recommendation in 2009, saying that conserve most of them. However, surgery is effective after the age of 15. Okay, so now in 2010, there was this very famous study. This is like among the first ones which compared operative versus non-operative. Okay, and the pendulum started swinging towards the operative. They started saying that they return earlier to sports, and the ones we conserve actually have symptomatic malunion. Okay, we are talking about adolescents only. So taking a cue from this, they started reviewing the POSNA, the North American Pediatric Orthopedic Groups. And they found as many as 50% of the consultants wanted to operate patients who were above 15 years of age. So note that people are tending to operate only when the child is above 15 years of age. Again, 2012, the pendulum still is in favor of operative intervention. Dr. Hosalkar's paper actually started saying that the amount of overlap required in the pediatric clavicle is less because the length of the pediatric clavicle is less. So instead of 20 millimeters, operate when there is only a 15 millimeter. So the indication started getting stretched out. People started getting more excited about operating on the pediatric clavicle. And they started saying that we get higher scores, okay, on the outcome measures if we operate the pediatric clavicle. However, now the surgeons started panicking. So they said they should have some papers on the conservative management. So then they started giving papers saying that actually there were no significant difference in the pain strength and shoulder range of movements, and patients are actually returning to better sports in spite of conserving. And this landmark paper by Waters said that no amount of malunion in the pediatric clavicle is actually causing symptoms. So now, where do we stand? People started publishing, comparing again operative and non-operative. And they started saying that operate only for absolute indications and not for relative indications. There is no statistical difference between the operated versus the non-operated fractures. And there is a comparable outcome between the two. So this paper I feel is very important, saying that you are going to operate versus non-operating on a pediatric clavicle fracture as per your training and as per your patient population. Okay, it's not so much of the fracture dependence. And there is no level 1 evidence, and we require future large randomized control trials to actually apply the adult data on the pediatric data. However, this POSNA 2018 talk says that the culprit paper was what Sir had also shown, the Mackey paper, and they do not let the orthopedic surgeons to believe that a shortening of shoulder girdle is acceptable. So we still continue to think about operating on the pediatric clavicle fracture. So there are two myths, okay? Myth 1 is we conserve all pediatric clavicle fractures, nothing happens. And myth 2 says conserve up to 15, conserve in low demand patients, however judicious use of implants in heavy, high demand, older adolescents. So we continue to have publications on adolescent clavicle fractures in the athletes. And as a pediatric orthopedic surgeon, I would earnestly tell you to recognize kids not by their age, but by their morphology. So this is the same class, right? Everybody is 15 years old, but they look so different. They play differently. So each one of their clavicles will be treated differently.